Hi, this is Dr. Farley. In this week's blog, I want to go over a new article that just came out of JAMA Internal Medicine. The date on it is, sorry, it's not new. It's from JAMA Internal Medicine, June 24th, 2019. And the name of the paper is Anticholinergic Drug Exposure and Risk of Dementia. So in here, these doctors looked at a certain class of drugs called anticholinergic and what's the risk of dementia. And I tell you, if we did more research like this, we would see that many classes of drugs are creating future diseases because keep in mind this also, there are no drugs required for health, period. They're not part of normal anatomy, physiology, and biochemistry, and we should only be using them in cases of crisis or to save our life. But to get on drugs on a long-term basis and not look for the reasons why our brains and bodies are not adapting and to think that we've somehow created health is absolutely not true. And this is a great example of it. So basically in here there was 225,000 controls, and which is a lot of people, by the way. And basically they analyzed the data to say, hey, if you were on these certain drugs, do they create increased risk of dementia? And what we found was yes. So the category of drugs are anticholinergic antidepressants, anti-Parkinson's drugs, antipsychotics, anti-epileptic drugs, and basically what we found is this. There's over 100% increase in dementia for the people that were tracked in this study. And specifically, there were significant increases in dementia for patients with anticholinergic antidepressants. So you get one of these drugs for depression, which in my opinion is a sign of early neurodegeneration. And your risk goes from 124% to 134% increased risk for the antidepressants. For the anti-Parkinson's drugs, your risk for dementia goes from 116% to 200% increased risk for dementia when you use the anti-Parkinson's drug. The anti-epileptic drugs, this was 122% to 157% increased exposure risk for dementia. And what they found is that the longer you used it, the higher the risk. So if you used it for 3 years to 13 years, your risk was 141 to 152%. If you used it from 5 to 20 years, your risk was 132 to 157%. So this is one paper. I'll have it posted underneath here if you wanted to print it out and read it. But it really is staggering to see that we buy into the merry-go-round of a drug for this and a drug for that and a drug for this, not considering what are the long-term consequences. We really need to peel back and understand that health is anything that is a deviation from 100% adaptability. And we need to look at the specific stressors, physical, chemical, and auto-suggestion, and identify those, and then do what we can to improve adaptability. And the drugs do not improve adaptability. As you can see, they lower adaptability and they increase your risk of diseases over time. In this case, a major increase in risk for dementia in those class of drugs. So thanks, as always. If any questions, please let me know. God bless you, God bless your family, and God bless America. Thanks. Bye-bye.